Hello, it's me, Dr. Butler, your favorite exercise scientist. And this is where I discuss all things about women's health, strength, and thriving through every season of life. Today, we're having a conversation that far too many women walk into without enough information, enough support, or enough space to ask the questions that matter. Hysterectomies. Hysterectomies are one of the most common surgeries performed on women in the United States. Yet the experiences, the emotions, and the recovery and the long term impacts are rarely discussed in a way that feels honest, human, and empowering. Whether you're preparing for a surgery, recovering from one, or trying to understand how it may affect your hormones, your identity, your strength, or your day to day life, this episode is here to give you clarity. We're breaking down the science, the options, the myths, and the reality so you can walk into every important appointment informed, confident, and in control of your health journey. So let's get into it. A hysterectomy is a surgery where the uterus is removed, and in some cases, the cervix, the ovaries, and the fallopian tubes are removed as well. It's a significant procedure, but it's often recommended when other treatments haven't fully relieved a woman's symptoms or improved her quality of life. Conditions that typically result in hysterectomies are uterine fibroids. 60% of hysterectomies are a result of this condition, which is the most common reason. Fibroids are non-cancerous growths that can cause heavy or painful menstrual cycles, pelvic pressure, and an enlarged uterus. Next, we have endometriosis, which affects about 1 in 10 women worldwide, which is most commonly found in women who are in their 20s and 30s. And it can cause severe menstrual pain, heavy bleeding, digestive symptoms, and infertility. Endometriosis happens when the tissue behaves like the uterine lining and it starts growing in places it doesn't belong. This tissue responds to hormones, just like the lining inside of the uterus, meaning it can thicken, it can break down, and it can bleed during each cycle. For nowhere for that blood or inflammation to go, it can cause irritation, scarring, and sometimes ovarian cysts. Next, we have pelvic organ prolapse. If you remember from my episode on pelvic health, pelvic organ prolapse happens when one or more organs like the bladder, the uterus, the urethra, the vagina, the small bowel, the rectum shifts out of their normal position. If you haven't watched that episode, definitely go back after this one. When those organs drop, the structure that supports them, that holds everything in place, it becomes weakened. And it's one of the most common reasons pelvic prolapse accounts for 11% of hysterectomies. Next, we have gynecological cancers, such as endometrial cancer, ovarian cancer, and cervical cancer. Hysterectomies are critical treatments for cancers of the reproductive system. So, what exactly is a hysterectomy? A hysterectomy is a surgical procedure where the uterus is removed. And depending on the woman's diagnosis and symptoms, the surgery may also include removing the cervix, the fallopian tubes, and the ovaries. There are a few types of hysterectomies. The first one is a partial. This is where only the uterus is removed and it's leaving behind the cervix. The second one is a total hysterectomy. This is where the total removal of the entire uterus and cervix is removed, and it's the most common type. The last one is a radical one. This is where they remove the uterus, the cervix, the upper vagina, and the surrounding tissue, which is usually only done for cancer diagnosis. So now that we have a better understanding of what a hysterectomy is and the conditions that may require one, let's get into the biggest topic that comes up after the procedure has been done and none of the clinical staff seems to prepare you for. What about them hormones? And the answer really depends on entirely whether you had your ovaries removed or if they was left in place. The uterus itself is not a hormone producing organ, but the ovaries absolutely are. So the hormonal impact varies from woman to woman. Let's break it down in a way that feels clear and supportive. If your ovaries are left in place, they will continue producing estrogen, progesterone, and testosterone. You do not go into menopause immediately. Your hormones level will decline naturally with age, just like they would without surgery. You still may experience hormonal symptoms over time. If one ovary was removed, the remaining ovary usually compensates. Hormone production continues. Menopause may arrive slightly earlier, but not abruptly. But now, if both ovaries were removed, this is the biggest hormonal shift. Removing both ovaries can cause surgical menopause, which happens immediately, abruptly, and often more intense than natural menopause. Because the ovaries produce the majority of our estrogen and testosterone, their removal leads to a sudden drop in estrogen. This is where you're going to have your hot flashes, your night sweats, your vaginal dryness, and sleep changes. Your progesterone is dropping, so you're going to have mood shifts. Your testosterone drops, so there will be a change in libido, energy, and muscle mass. This is why women feel the effects quickly and strongly. And removing the ovaries triggers menopause regardless of your age and all of the issues that come with the menopausal stages, such as low bone density and muscle mass, cognitive changes, vaginal changes, low libido. Energy may occur, low energy levels, immediately and abruptly. The last thing I would like to highlight with hysterectomy is changes in sex and intimacy. So, should you expect any changes in this area? Well, yeah, maybe. The good news is the changes are very widely in their influence by anatomy, hormone, healing, and emotional factors. Most women resume a satisfying sex life, but some notice temporary or long term shifts. Some women notice changes in the vaginal sensation, especially if the cervix is removed and the top of the vagina is closed. The vaginal canal may be slightly shorter, but it remains elastic and adaptable. Most women return to comfortable intercourse once healing is complete. Some may need to explore different positions early on to find out what feels best. If the ovaries are removed, estrogen suddenly drops, causing vaginal dryness, lower libido, hot flashes, sleep changes, and mood shifts. These symptoms can make intimacy feel different or less comfortable. These symptoms can be relieved by lubricants or vaginal moisturizers. Healing tissue, swelling, and nerve recovery can be temporarily affect your arousal, your sensitivity, and orgasm intensity. These changes typically improve as the healing processes goes on. Now, most doctors are going to recommend that you wait 6 to 8 weeks before engaging in penetrative sex to allow the vaginal cuff to heal and reduce infection risk. So, let's listen to our doctors. A hysterectomy can change sex and intimacy, but most changes are manageable, they're temporary, and they can even be positive once the underlying condition is resolved. That's where we're going to wrap up today's conversation. Hysterectomies are big decisions, big experiences, and big transitions. And you deserve more than a rushed explanation or a stack of discharge papers. You deserve clarity. You deserve honesty. And you deserve care that sees the whole woman and not just an organ being removed. Whether you're preparing for a surgery, recovering from one, or still trying to make sense of what's happening in your body, I want you to remember this. You're not broken, you're not alone, and you're not losing your womanhood. your strength, your identity, your femininity. None of that lives in one single organ. If this episode brought you clarity, comfort, or even just a moment of finally someone said it, share it with another woman who needs this conversation. We're building a community where women are informed, supported, and never dismissed. Like, share, and comment on this episode. Thank you for spending time with me. I will see you the next episode, which will resume in June. Until then, keep honoring your body, asking questions, and keep thriving through every season of life. See you later.